Welcome back. 1.2 of Medication Management, Emergencies. Recognizing emergencies and other threatening conditions. What is your role? Constantly observe and report any changes to the correct person at the correct time in the correct way. Okay? Types of health-threatening conditions. You have a true emergency, a non-emergency that has a health-threatening condition, and other changes in physical condition and behavior. Okay, so always an emergency, bleeding. Sometimes it's not. Can you stop that bleeding? Okay. Accidents with severe pain. That's a concern. Did they break something? Okay. Choking that is unresolved with you using your CPR or emergency preparedness, meaning doing your Heimlich maneuver. An emergency, no pulse. Immediately contact 911 and start CPR. Danger to self or others. Remember to remove all others to safety, and then ensure that that individual is staying as safe as possible while you are contacting help. Another emergency is loss of consciousness. Okay? How do you respond to an emergency? What is the appropriate method in responding to emergencies? Never leave the resident alone or individual. Call 911. Check emergency numbers. They are posted throughout the house. They are near the phones, okay? Provide assistance for the clients, whether it's the individuals that's in the house surrounding it or the individual that is having the emergency, the medical emergency. When 911 or emergency supports come, ensure that you collect the record that they have, meaning their patient identification record. Make copies of their profile sheet or their face sheet. Make copies of their medication record, and then you give that to the emergency supports. Then you want to ensure that you inform a supervisor. And then what will happen is either that supervisor will meet the individual at the location, or they will have someone come relieve you so that you can go to the hospital with them until their family is able to join them. You are not responsible for contacting the family in a group home setting. The house manager, the program director, one of them are responsible for contacting supports. You want to try to give as much first aid or much support as you can until emergency services come to relieve you. During that time, you want to ensure that you tell them everything that happened prior to the emergency, during the emergency, and until you gave the handoff. Emergencies cannot always be prevented. Therefore, it is very important how you act during that emergency and how you are able to manage that emergency, which will dictate the next outcome or dictate the outcome. Okay? Non-emergency health-threatening conditions. Okay? A fever is a non-emergency. You can treat that. Repeated episodes of angry or aggressive behavior is a non-emergency, but it is a health-threatening condition because they can cause harm to themselves or to someone else. So you want to treat it accordingly. Try to de-escalate. Another non-emergency health-threatening condition is diarrhea that is not affected by approved over-the-counter medications. So if you're having consistent diarrhea, persistent diarrhea, that can become a concern. A rash that lasts for days and gets worse, that's a health-threatening condition, but it's a non-emergency. So there's treatment that should be put in place. A severe seizure. However, seizures can be treated with the right medication and the right interventions. If they're withdrawn, that's a concern, but it's a non-emergency. Confusion, once again, it's a concern, but it's a non-emergency. And abnormal complaints of pain is a concern, but it's a non-emergency, meaning you do not need to call 911. Okay? Other significant changes is changes in the sleep pattern, colds, low fevers, or mild diarrhea, minor bruises, lack of coordination, or slight rash. These are all significant changes that must be documented, and you must make sure that you have told the house manager or your program director to ensure that they are treated accordingly. Do not dismiss the changes, even no matter how small they are. This is the section on emergencies.